Hi everyone, this is Taylor Boone and I will be going over kidney stones today. So let's start with the big picture here, the anatomy. With kidney stones or renal calculi, we're referring to the urinary system. This system consists of the kidneys, ureters, urinary bladder, and the urethra. The kidneys are in the retroperitoneal space in the posterior abdomen. One kidney sits on each side of the vertebral column. Urine flows from the kidney through a tubule called the ureter. So we're going from the kidney down to the ureter, and then we go from there into the bladder, and here it will sit until it's ready to be excreted, and then it's done so through the urethra. So now we'll go over what kidney stones actually are. They are called kidney stones because in the Greek language, lithiasis in Greek means stone, and nephron is the Greek name for kidney. So from nephrolithiasis, you get kidney stones. They are crystal aggregates that are composed of organic and inorganic materials. They can be located within the urinary tract, and these can form within the kidney in the tubules or in the collecting system, and then they would migrate to more distal structures. The kidney stones are composed of crystalline component and non-crystalline organic component. That is called the calculus matrix. It's made up of protein, sugar, glucosamine, bound water, and organic ash. It represents a small percentage of the overall weight of the stone. Crystallization occurs when several solutes or particles are in the urine. Then the urine will become supersaturated, meaning that certain solutes or particles will form crystals if their concentration within the urine is too great. Crystals begin development in the concentrating areas of the nephron, that's here, and also within the kidney pelvis, and that's right over here. Crystallization can be enhanced when someone is dehydrated or has a higher than normal level of solute or particles in their urine from excessive excretion. Next, we'll go over some of the general contributing factors to kidney stones. Stone formation occurs with the increase of solutes or particles found in urine. This can be promoted or inhibited by many factors that are inherent to the urinary tract. It can also be unique to the individual and then the type of stone that they produce. Here are some of the few general contributing factors to the production of kidney stones. First, we have hyperparathyroidism. Certain medications can cause kidney stones. Irritable bowel disease, past medical history or family history of kidney stones is a big one. Gout is another one. Next, we have obesity. That includes, this is an and or excess dietary meat, sodium, and or oxalate in your diet. Additionally, hypertension, urinary tract infections, type 2 diabetes, dehydration, a sedentary lifestyle, not moving a lot, that can happen during the workday or at home, and then congenital kidney defects or anatomical alterations. In total, there are 5 types of kidney stones. First up, we have the calcium oxalate. It is the most frequently observed kidney stone in both children and adults, with a 75% incident rate. The cause is relatively unknown, it's idiopathic, but family history is common with this one, and the risk factors for these kidney stones are hypercalciuria, increased level of calcium in the urine, and or hypercalcemia, which is the elevation of sodium in your blood level. Hyperoxaluria, which is the excessive excretion of oxalate in the urine, and then hyperuricosuria, the excessive amounts of uric acid in urine. Struvite is the next type. This and the uric acid stones tie for incident rates. They go between 7% and 10%. For the struvite one, the occurrence is due to infection within the urinary tract. A lot of the times the formation can be assisted by an underlying anatomic or functional abnormality that can promote urinary stasis where urine's not being excreted. Risk factors include urinary tract infection with urea splitting bacteria. For the uric acid stones, risk factors again include hyperuricosuria from gout, acute leukemia, glycogen storage disease, malignancy, excessive intake of meat, fish, and poultry, and an increased body mass index or type 2 diabetes. The last two types, cysteine and then the following one, those are the least common ones. They're typically associated with just family defects, and then the last one where it's just all but 1% of incidents, that's mostly due to a specific type of medication someone's taking. Kidney stones can affect people worldwide. They can even be traced back to the Egyptian mummies. It's estimated that 10% to 15% of Americans will experience a kidney stone. The risk of stones is lower among African Americans and Mexican Americans in comparison with Caucasians. Family history, of course, increases the risk. Additionally, I mentioned this before, occupations where there's increased exposure to high temperature or decreased movement specifically will increase risk. And finally, kidney stones are uncommon before the age of 20. Typically, you won't see them until right between 20 and 30 years of age. Signs and symptoms are dependent upon their size, location, and they can also mimic other causes of pain in the abdomen. Pain can vary from vague to extreme. Typically, the pain, if it's in your flank, which is where this person's holding their back, that's when the pain's going to be very high. It can be accompanied by nausea, vomiting, tachycardia, and tachypnea. Once the kidney stone moves down to the bladder, though, the pain will dull. But then if the stone obstructs the urethra, you can expect some dysuria, urgency, and frequency with needing to void, and typically you'll see dark or foul-smelling urine. If the stone is in the urethra, hematuria can occur, and the size just depends upon the size of the stone.
Stones are a common problem in the United States. Up to 1 in 10 people will have a stone over their lifetime. They occur when different elements in the urine crystallize out, such as calcium. They tend to form a crystal that continues to grow in a certain condition. And with time, those stones can grow and can cause blockage of the kidney or other painful symptoms. Focus on modifying aspects of people's lifestyles and diet that we can in order to minimize their risk of forming stones. Especially here in Southern California and other warm climates, some of the things we focus on are staying well hydrated, drinking over 2 to 3 liters of fluid per day, having a low sodium diet or a reasonable amount of sodium, not too much protein in one setting, whether that's fish, red meats, or other sources of protein, and then also sticking to a reasonable amount of calcium in your diet. So there's 3 mainstays of treatment that we have for stone surgery, partly shaped by the location of the stone and also the size of the stone, and also an informed decision that we talk with the patients about their preferences for treatment. The least invasive option that we have is called shockwave therapy, where we direct a sound wave of shock energy at the patient's body from the outside, and the shockwave is targeted to the stone inside the kidney and breaks it into pieces, and the patient passes those pieces on their own. The more definitive treatment for stones is a procedure called ureteroscopy. That's where we use a small camera and small laser and other instruments to go directly inside the body all the way up to the stone. And we use a laser to break it into pieces and a basket where we can remove the stones directly. For larger stones or stones where we need to have difficult access, there's another procedure called a percutaneous nephrolithotomy, where we can actually put a camera straight into the kidney through the patient's back and use a vacuum cleaner type device to essentially break and remove the stone. I think a couple things that are worth noting are that once you've had a stone, there's about a 50% chance you're going to have another one within 5 to 10 years. So I think active management and really taking ownership of treating the stone, but then setting yourself up for success in terms of diet or medicine, really seeing a physician and following up on that is really important to keep yourself healthy, prevent another stone.
So for interventions with medication, you're only looking at opioids, and that's just to take the pain away if you're trying to pass the kidney stone without additional interventions. And you can really only do that if it's 5 millimeters or less. Going up to 7 millimeters, you only have a 50% chance of it passing with just those pain relievers. Anything larger than that, you're going to need additional intervention. But aside from just intervention, we also want to look at prevention. And the biggest way to prevent is through dietary modifications. That includes increased water intake, ensure that you have the adequate dietary calcium intake, avoid calcium supplementation, avoid foods with additional vitamin D, limit your intake of coffee, tea, or soft drinks to less than or equal to 2 a day, reduce your protein intake from meat, fish, and poultry. After intervention and passing the stone, the typical urinary tract function should be going on with voiding urine without any pain or smells, or pH levels should go back to normal. If left untreated, there can be increased damage to the ureter and kidneys. Also, you're not going to be passing urine, so you're going to end up in the hospital anyway. Recurrence is expected in 30% to 50% of adults, depending on the type of kidney stone. So really want to look at those dietary modifications if you've already had one to try and reduce those numbers.